Everyone, my name is Pierre Elzoghbi, and today I will be discussing my final project for CS 2316 that revolves around tobacco. So let me begin with the topic and hypothesis. My project explores the relationship between tobacco retailer density, individual consumption, and the impact on smoking-related deaths each month. My project's hypothesis is that more tobacco shops could lead to more smoking and thus more health-related issues and deaths. The aim is to sort of uncover data-driven insights that could inform policies to improve public health. So let's dive into my motivation. I chose this topic because I wanted and was motivated to delve into the impact that tobacco has on public health after seeing so many people, including loved ones, who smoke. I also wanted to understand related policy effects and see if awareness campaigns are having any impact on this topic. After delving into immense research on the topic, it was very difficult to find data sets that matched my analysis and hypothesis, but I ended up finding 3 data sets after digging deep, which revolved around the monthly death count due to smoking-related health issues, historical tax rates for tobacco products, and registered retail dealers of tobacco products. I downloaded, web scraped, and retrieved all these data sets, which I will delve deeper in the upcoming slides. Starting with the downloaded data set, here, this is a code that defines a Python function that downloads a CSV file from the CDC website with a given URL and saves it, reads it into a pandas data frame, and it's filtering for certain columns related to respiratory diseases. It replaces numeric month values with their corresponding string name, and then writes the process data frame back to a new CSV file. After running the code, I was able to clean the data and reduce columns from 21 to 5 while maintaining the rows. Now, I would like to also note that this data set did not include any inconsistencies, but I did clean it. Moving on to the web scraping portion, I found a web page that had immense data. There were so many tables, but one of the tables I was interested in was table 8. So I had to find a way to extract only that table because it had to do with tobacco, which related to my hypothesis. So to do this, I included functions to locate the table containing the word tobacco, and I performed string manipulation to clean and extract numerical data and units of measurement from the text. The script checks for the presence of letters and strings and cleans up tax-related information by removing unnecessary characters. While examining this data, I noticed inconsistencies, and I tackled these by stripping out non-numeric characters from tax figures to only keep numbers. I also split the tax rates from their units for consistency and transformed date strings into date-time objects for a uniform format. And to maintain data quality, I removed any rows with missing or incorrect dates. Lastly, I updated the data frame's index with descriptive titles, which clarified the data for deeper analysis later. As we can see here, this is before the processing, and this is after the processing. Moving on to the JSON retrieval and cleaning. I've written a script that pulled out data from a JSON source online and transforms it to a CSV file. As we can see here, I have a list of US state codes and a dictionary that maps these codes to their full state names. I can check whether a given code is a valid state name, and if it is, then it converts their code to the full state name. In my code that I tackled, I noticed that the dataset had some inconsistencies, so I tried to resolve these. The geospatial discrepancies, I solved this by extracting latitude and longitude coordinates from 2 different columns and formatted it into my data set. Where coordinate extraction wasn't possible due to missing or incorrect information, it's important to note that I also set those values to NaN to maintain the integrity of my data. I also mapped state codes as mentioned, and during the cleaning and processing phase, I dropped irrelevant columns to streamline my analysis, removing unnecessary data that could complicate the process. By converting the strings of coordinates to actual numerical values and disregarding rows with missing location data, I further refined the data set, as we can see here in the before and after. Moving on. With my data sets now clean, I wanted to begin my insight analysis. My initial insight revolved around the question, was there a steady rise in respiratory disease deaths given factors like smoking? After combining diseases into a total disease column and grouping them by year, I noticed that the data showed an unexpected fluctuation peaking in 2018, which we can also see in the graphical representation over here. These observations prompted a deeper dive into the role of the external factors of what could have affected this, and processing the disease data into a total data metric I was struck by the complexity that the visual uncovered, and it prompted me to research. And after delving into research, I noticed that factors like public health, policies, and societal changes could have impacted this. So this analysis was really an eye-opener, highlighting the multiple influences on health trends. Moving on. In developing my second insight, I used a Harverson function. I really wanted to understand how accessible are these retail stores to the residents of New York City. Doing this, I analyzed over 20,000 stores, and I noticed after coding that the minimum distance of one of the stores was 0.15 kilometers from the city's heart, and the average of all the stores combined was 117.11, which really shows how widespread retailers are. And this close proximity could even influence New Yorkers' habits to smoke. And turning into the visual part, I wanted to create two visual representations for this insight. The first one clearly shows that there's a cluster of points near New York City, as we can see here in red. Most of them are near New York City. So anywhere that you are in New York City, you will be able to access one of these retail stores in order to purchase. Of course, there are some outliers that we can see in blue and yellow, but most of the points are really clustered. I also wanted to create an interactive data visualization. This was super fun to make. It was very hard. I'm not going to lie. It took some time, but it was very rewarding when it finished. Here I outputted the longitude, latitude, as well as the distance to New York City center, which showed as we get closer or further, there is always a cluster of points that represent retail stores, which shows that they are accessible to all residents at any time. No matter where you are, you will find one near you. Moving on. So here in my third insight, I wanted to compare vapes and cigarettes and how much each store is selling of which. And I wanted to do this to sort of analyze future outcomes because, you know, in historical times, we started with pipes, then we moved to cigars, then cigarettes, now e-cigs and vapes. I wanted to know really what is next that is going to be created that damages our health this month. And here we can see that even though vaping is new, it is being sold in the top 20 districts that I numbed down into the x-axis that you can see that separates a blue bar chart for the cigarettes and an orange one for the vapes that are being sold. And I found this to be really a great proportion to visualize. Moreover, delving into my fourth insight, I analyzed the link between tobacco use and respiratory disease mortality by retrieving a negative correlation of negative 0.76, which indicates that lower tobacco consumption is associated with fewer deaths from chronic respiratory conditions. After delving into the data, I created a combined insight function that merged my data sets, and this also showed that reducing tobacco consumption can lead to a meaningful decrease in respiratory-related deaths, which highlights the impact of public health measures. Seeing the inverse relationship between the tobacco use and respiratory deaths on my graph was very surprising at first, but it led me to consider factors like the lag effect, where the impact of smoking on health doesn't show up immediately, or healthcare improvements or anti-smoking campaigns that could have affected this outcome. In my final analysis, I ran an OLS regression model. This was also really fun. It was my first time doing this. I retrieved a positive coefficient of 3.55, which indicates that increases in other respiratory conditions could predict a similar rise in chronic disease. An R-squared of 0.68 also clarifies that there's a substantial relationship between these two. Moving on to my data visualization for Insight 5. Here, I noticed that, as you can see, my blue points are my data set, and the red line is the linear regression that models the future prediction up to 2028 that shows a consistent increase in the total number of respiratory and chronic diseases. Now, to conclude my insights, I wanted to say that my project indicates that there is a correlation between the number of registered tobacco dealers and individual consumption, which in turn correlates with an increase in smoking-related deaths and long-term respiratory diseases. Through this project, I wanted to also mention the conclusion that indicates that there is a correlation between the number of registered retail sellers and individual consumption, and as we can clarify, greater accessibility leads to greater and easy consumption, which in turn results in health-related diseases. Through this project, I really had a journey of self-reliance and discovery by choosing to work independently, which allowed me to deeply engage with the material at my own pace. I was able to change, work on my code, and even challenge myself, which was very overwhelming, but I did learn a lot. And one of the highlights of this project is being able to use the linear regression model for the first time, and even the interactive model. It was a very hands-on experience with data modeling and analysis, but the project turned out to be rewarding and exciting. Thank you so much. These are my references. I hope you enjoyed.